Hi, everyone. Thanks for joining. We'll get started here in another minute or two. Thanks. We'll get started here in one more minute. Good morning, everyone. Hopefully you can hear me. I'm just going to get one more confirmation. Okay, great. So thank you so much for joining us today for Transforming Triage with Patient Relationship Management. I'm Stephanie Ginger. I'm the Senior Marketing Manager here at Navigating Cancer. I've been here for 3 years, so I've been able to watch our software really develop into a powerful tool to help cancer care providers and their patients, and especially the triage functionality. So I'm really happy you can join me for today's session. I think this should be about 20 minutes, so we'll have plenty of time for questions if you do have any. So that leads us to a bit of housekeeping. Please, you should be all on mute, but please feel free to enter questions using that Q&A panel. It might be in a different spot on your screen, depending on what version you have. And then if you do get pulled away today, don't worry, I will follow up with a recording and some other information. And then finally, at the close, I do have a really short survey, and I'd love to hear what you thought, and then also if there are other topics you might be interested in having Navigating Cancer present a webinar on. So hopefully today you'll leave with a really clear understanding of the ways our patient relationship management solution, and particularly Triage, is helping cancer care providers meet the challenges in the current healthcare landscape and provide better care to their patients. So I'll provide a brief overview of Navigating Cancer and then give you a tour of the key features of Triage. Then we'll take a look at some industry best practices and also the positive impact that our software has been having for our customers. So a quick introduction to Navigating Cancer. If you're just getting to know us, oncology is all we do. We were founded 10 years ago with a total focus on developing technologies that help cancer patients and those who care for them. And then since about 2014, we've been expanding our digital platform to facilitate really seamless care coordination, to leverage patient-reported outcomes, and also to really improve patient experiences. We're currently building out our mobile solution for patients so they have even more easy access to care and information in a convenient way, and rolling out phase 2 of Health Tracker, our remote monitoring program, in the coming months. And we also continue to develop tools to help you more easily manage entire patient populations like the oncology care model. So it's a really exciting time for us here. So we focus on developing tools that connect the patient to their care. We want to provide education and resources at appropriate times. We want to support patients with things like medication reminders, and then also follow-up information to ensure that they really have what they need to stay as healthy as possible while they're undergoing treatment. And then we also provide the care team with flexible work boards for triage, patient-reported outcomes, and more. We enable a holistic view of what's been happening with the patient and that patient experience. And then we also provide robust reporting capabilities. So these are all intended to help you not only provide really great point of care, but also to understand the areas for improvement, maybe missed opportunities, areas where efficiencies are being realized. So our solution spans much more than triage, from care management to remote monitoring to engagement and support for patients. We've developed the most comprehensive oncology platform on the market. So today's session will focus on one of those key building blocks, which is triage. But first, what is patient relationship management? This is how Chilmark Research defined it last year. True patient relationship management is more than just CRM for healthcare. It focuses on patient needs outside of the healthcare facility, in between care episodes, as they live their everyday lives. And we think about it in a really similar way. Our PRM is intended to put the patient at the center of their care and give them a close connection to their care team, even when they're not in the clinic. And especially as health teams grow to meet the needs of value-based care, and now include nurses and providers, but also navigators, case coordinators, case managers, social workers. We've even heard massage therapists, dietitians, financial counselors. So these teams are becoming really complicated, but they're formed to really support the holistic needs of the patient. And this tool helps coordinate all those activities and give everyone a really centralized view of what's happening with the patient. So with PRM, patient needs, and this is kind of how we think about our system, patient needs are reported into one central place. So they could come in by phone call, by remote monitoring, through digital assessments like distress and depression, but they're all entered into the same system. So we're hoping you can replace those disparate tools, Excel spreadsheets, sticky notes, voicemails, Outlook calendars, and really focus on what's pertinent to you that day. Our software stratifies by severity, but it also enables the care team to leverage a robust set of filters. So that ensures that issues are managed by the appropriate member of the team in a timely way. And we'll take a look at those in a minute. So I don't want to spend a lot of time here, but I did want to point out that we are EMR agnostic. Our solution is flexible, straightforward. We connect to all oncology EMRs with 5 easy interfaces. And we're proud to be the leading PRM solution across the country with integrations with OncoEMR, ARIA, iKnowMed, and others. And we're really excited. McKesson recently selected Navigating Cancer as its preferred PRM vendor, and we're currently rolling out our solution at several additional practices. So at Navigating Cancer, we think about triage as much more than symptom management. It's really the foundation of our platform. This streamlined management of incoming patient needs is only becoming more important. I've just included some of the challenges here: reducing hospitalizations, meeting the requirements of value-based care, and so many more. We did recently hear from one customer that they have more than 40 open nursing positions, and while that may be the exception, it highlights the need to ensure that the right person's doing the right job and able to practice at the top of their license. We really want to be able to work in the most efficient way, and leveraging technology is a great way to do that. Dr. Ray Page at the Center for Cancer and Blood Disorders said one of the key strategies for delivering oncology care at a relatively low cost is to avoid unnecessary, unwarranted emergency room visits for patients undergoing active treatment. And we think that our technology is a really integral part of that, of achieving that. So our software is really can become your call center. So for instance, operators can create incidents in the system, schedulers can handle appointment-related issues, and nurses can focus on managing symptoms and side effects as soon as they arrive. Social workers can focus just on those distress and depression assessments. So really everyone can focus on the job at task for their role. So now we'll look at how you can use our software in a lot of different ways. While it does stratify patient needs, like with symptom-related issues put at the top of the list, everyone on your team can use the triage workboard by filtering according to the incident types that are related to their role, and we'll look at that in a minute. So each team member is able to really focus on what's pertinent to them. So this is the triage workboard. This is where issues that need to be managed that day are listed. You'll see other workboards, including patient-reported outcomes and items due, but today we'll just look at triage and its key features. So incidents can be quickly created here or right from the patient's record, and then it's automatically stratified according to severity, so the most serious issues can be managed first. So to create the incident, the patient's basic information is confirmed and collected. The incident type and notes can be added here. And I wanted to point out that our system includes both types and subtypes, which is really useful for filtering, reporting, analysis, if you want to understand how many appointments are being rescheduled as opposed to canceled, or the number of same-day appointments. You can also drill down on frequency and severity of symptoms being reported. So that we're seeing this as becoming a really powerful tool for our practices. So before we look at managing an incident, I wanted to go through the filters that are available. So you can filter, and you can use one or none or all of these, so they can be really useful in really focusing your workboard on what you need to work on. So you can sort it by patient populations, by providers, incident types, locations, assignees, and then if you just want to see those items assigned to you, just click here. Okay, so now let's look at managing the ticket. You can either manage the ticket right as you're creating it, or if you use a more centralized model where incidents can be created by an operator, those open tickets get added into the workboard and will be managed by the appropriate person by clicking on it. So you'll first see a snapshot of the patient's information, so you can get a quick view of what the ticket's related to. If you're able to resolve the ticket just with a phone call, you can enter your notes and simply click resolve. But the triage functionality also includes really easy tools to record activities and create follow-up tasks. So no more sticky notes and all those other tools. You'll have all your information in one place. So let's take a quick look at that. So you can click here to schedule a follow-up task, and this is really great. It's associated with the patient. You can add some information about that, and then you can set the time due right down to the time of day. So you don't have to remember all these different things that you meant to do tomorrow or 2 days from now. Those will just be automatically populated to your workboard according to those specifications. And then if you want to record your activities, click here and you'll see a simple drop down, and this is where you can add the time you spent, and that'll also be added to the record. Now, if the incident type rather is symptom related, you can also easily start a symptom management pathway. So these symptom management pathways were developed with our clinical partners using ONS standards, and we update and expand them on an ongoing basis. The information also, I wanted to point out, is collected as discrete data. So reporting and visibility is really exceptional, especially compared with other systems like notes and messages. And these pathways include branching logic. So the nurse can assess the issue in a comprehensive and consistent way, and the pathway actually guides the conversation. So when the nurse has evaluated the patient, they can then select from this list of interventions and standing orders. And the great thing about this is these are customized to your site, so you and your care team and your providers can decide what you feel are the appropriate interventions, and that really empowers the nurse to take proactive measures and provide assistance to that patient right there rather than having to chase down a doctor or call the patient back. This is really streamlining care. So once you've completed your call with the patient, you can resolve the ticket and the information is sent directly to the EMR. But we're really excited about this feature. You can also send a follow-up message right to the patient's phone or computer. You can see in this example, it's auto-filling those standing orders and interventions we just saw on the last screen. And we're really excited about this because you can use it for a number of other things as well. And there's really nothing like this in the market. We're seeing this tool used for all sorts of applications. It really is helping close the loop with patients, not just with symptom management support, where maybe they're too ill to write everything down, or you're concerned they might have misheard or forget. You can also send test results or let the patient know a prescription's ready, or just answer general questions. This is a great way to, not only eliminate phone calls, but get information right into the patient's hand in writing to ensure that it's accurate. Okay, so the last feature I wanted to share about our triage is the reporting capabilities. So this is really great. We capture all sorts of data, and it's available to you at any time directly from your dashboard. So you can identify areas of improvement. You can quantify outcomes. You can look at those continuous process improvements. If you want to analyze same-day appointments to kind of understand if you are preventing those unnecessary ER visits, or understand, how quickly you're resolving symptom-related issues. This is becoming really powerful for our practices, as they work to improve the care they provide. It's hard to do that without understanding exactly how your resources are being used. So this is becoming a great, effective tool. Okay, so the last thing I wanted to share was just some industry information and some of our customer experiences. So through research conducted by the Advisory Board's Oncology Roundtable, they really found there were significant barriers for patients to report symptoms. Those included that they were unaware which symptoms were worth reporting. They assumed the care team would anticipate it and reach out to them. They didn't think the care team was available. They were afraid to bother the care team, or they were just not sure who to call. You can see here 38% don't report symptoms because they don't want to bother their doctor, and then only 10% are reporting voluntarily. So to counteract these, I'm going to go back to there. So to counteract these factors, they did identify effective strategies in their cancer care transformation playbook. And so these were to reduce unnecessary ER visits and hospitalizations, and they included standardized phone triage, utilizing remote symptom monitoring, and also providing proactive support to those high-risk patients. And in that report, they highlighted the Center for Cancer and Blood Disorders workflow, and our technology is the tool they use as the recommended model for phone triage. So at CCBD, they have dedicated triage nurses, and they're able to directly connect with patients. They use symptom pathways to evaluate those symptoms, and then they're empowered to advise the patient on the appropriate action to take next. And this is not only the approved model by the advisory board, but a study recently published in the Journal of Oncology Practice actually did quantify the savings that this model can result in. The study spanned 6 months. They looked at 2 mid-sized practices, CCBD and also Northwest Medical Specialties here in the Northwest, and they were able to identify a 6 to 7% reduction in ER events due to symptom management using standardized pathways. So they estimated that the annual number of avoided ER events due to triage was 426, and that amounted to a savings of $3.85 million for these 2 mid-sized practices. So unlike the old model of infusion nurses trying to check voicemails when they have a chance, deciphering incomplete messages, getting back to the patient when they're already in the ER, the centralized model that's used by CCBD and others really transforms care, connects the patient, and enables this really proactive care so that patients can get the help they need before they end up in the hospital. So we've also heard a lot of great feedback. We've seen impressive data from the practices we work with. I just wanted to highlight a few of those that we see as like the measurable impact on care. Fewer voicemails, quicker symptom resolution, reduced ER visits, reduction in number of operators, reduced wait times for patients, and most importantly, more satisfied patients. And let me know if you'd like to learn more about any of these, what we call practice spotlights. I'd be happy to share those. And then I just want to close with Navigating Cancers. Really, our mission is to improve cancer care for patients and those who care for them. We offer the most robust tools for the care team and the richest patient experience. So we continue to focus on enabling that care by improving technologies. We really listen to our customers, to our users. I think we're all learning as we go with value-based care, and so it's an exciting time to see some really promising results and see if we can't even do better for our patients. So I hope today's webinar has been helpful to you in gaining a better understanding of what we can do for your cancer program and your patients. And so now I would just take a few minutes if there's any questions, but like I said, please feel free to reach out to me at sginger@navigatingcancer.com and let me know if you'd like any additional information or if you'd like to schedule a full demonstration. Let me just see, give a few minutes for questions, but that does conclude today's webinar. I really appreciate you attending, and I look forward to hearing from you. Thanks.